I am very happy and very proud. People they came here with the interest to know more about orthopedic without surgery, about to change their face problem to a normal face, to change their appearance with good functional way, without surgery, without bleeding, without the risk of a general anesthesia. And this is make the people more happy that now the technology we can intervene with the minimum biology cost. And here I mean by biology cost with the minimum of cutting and breaking in the bone or in the muscle. Most question was asked by the people for their problem of airway breathing, because some people they have a risk of dying during the sleeping because the stroke stuck and they couldn't breathe at night when they are sleeping, and it is dangerous. And they are very interesting on this technique that we use only mini screw inside the palate to avoid big surgery or to avoid problems that may be related to the general anesthesia or the bleeding or general health. Like the first lady that I present on my lecture, she is 70 years old, and everyone told her, oh, at your age, it is very difficult, it's very different. Even surgery we cannot do, even this we cannot do. You have to take it like this. And then you see the slides when I present her, she looks much younger, 20 years younger, and she is more active and more happy to have that technique. So this technique is minimum cost, is a minimum use of the blood or bleeding or cutting with faster results. Even if you go with the surgery, you have 40 days to cover. And this technique, the third or fourth day of the putting this marby, you will breathe better. You start to breathe better. You start to feel yourself much better. This technique is now only in 5 countries in the world. So other countries and another society, orthodontic society, they are interested of this technique. Very soon next year we will expand our practice to come here in this place, and then we will have 8 orthodontic chairs, and we will have a classroom also to teach other orthodontics visitors from the state and from Canada. So Aruba should become a center of teaching orthodontics. We want to have tourists to come to Aruba not only for the weathers, but also to learn orthodontics technique, Arubian orthodontics technique.